Go ahead.
Thank you. Hi, everyone. Good morning, good afternoon, good evening, depending on which part of the world you're in. And happy CC Awareness Week. We're so excited to join all of you today live to celebrate Crohn's and Colitis Awareness Week together. So on behalf of SAIA, I'm thrilled to welcome you all to today's live. And our live is titled Family Matters, How to Support a Loved One with IBD. Like most of us know, for all of us as South Asians, family is so very important. Family is very, family is everything. So today we're going to do a deep dive into the importance of family involvement in IBD care and suggestions and strategies for us to consider to kind of create awareness, destigmatize IBD, and create a supporting and enabling environment for our South Asians with IBD, and talk about how loved ones can support us in this process. Before we get kicked off, I wanted to thank Pfizer for their partnership and support in bringing this event to life today. And with that, I think let's get kicked off with a brief round of introductions. I'm Madhura. I help run SAIA's patient outreach and advocacy efforts. Sharan, do you want to maybe kick us off?
Sure, thank you. My name's Sharan, and I'm from London, England. I was diagnosed with Crohn's in 2002, and I'm currently on ustekinumab and doing well on that. And I am with SAIA as the Director of Digital Engagement.
Thank you, and thank you for joining us. And it's going to be very exciting to hear your perspective as a pediatric patient, as somebody who's diagnosed as a pediatric patient as well. Amma, do you want to kick off next?
Yeah, I'm Viji Lakshmi. I'm Madhura's mother and a professor of management. That's about me. I'm happy to be part of this conversation.
Yes, and thank you for joining us. I think this is the first time we are doing an event together, so it's going to be exciting and interesting to see how that pans out. And finally, Dr. Neil, over to you.
Hi, everybody. My name is Dr. Neil Nandi. I'm an IBD specialist in Philadelphia, and I specialize only in the treatment of Crohn's and ulcerative colitis, and I'm a proud co-founder of this wonderful organization of SAIA. Thank you for having me.
Yay. Thanks, Dr. Neil, for doing this. And I'm so excited that we have such a diverse set of perspectives today from a caregiver, patient, as well as a clinician perspective. And with that, I just think we should dive straight in, if that sounds all right.
Let's do it.
Awesome. So one of the first things that we're going to discuss really is what's the family's role in an IBD diagnosis? And, to share a little bit from my perspective as a patient as well, I think like with other South Asians who have IBD, family has been very central in my journey. Both leading up to the diagnosis, but also since then, figuring out treatments, figuring out how to get this disease better controlled. For me, my symptoms began when I was very young, but we didn't really have a diagnosis at that point. We didn't know who to reach out to. And given that, I was 4 or 5 years old when I started to experience many of these symptoms, I did need my family, especially my mother, to advocate for me and kind of help manage my care better. And this is something I'm very grateful for. And I'm so glad to have had my mother doing her best to fight for me with whatever she knew, both to be evaluated as a child and then again as an adult, kind of dragging me when I was not well and making sure that we finally figured out what was going on. Given this kind of, protracted 20-year diagnostic journey, I've also noticed that sometimes it's very hard for my family to understand, especially that I was suffering because, we were getting all of these medical all clears and they were telling me that there was nothing really going on that the doctors could figure out. And at that time, it was through all of these social interactions that I started to internalize that talking about bowels is very taboo. And it made me feel like hearing from my family and medical professionals that couldn't quite figure out what was going wrong made me feel like maybe my symptoms are normal. Maybe it's normal to live with month long of diarrhea and vomiting and weight loss. Maybe that's just how everybody lives with it, right? So when I was finally diagnosed, I think it was very shocking for all of us because none of us really saw it coming. And post-diagnosis as well, there was a lot of family pressure to kind of try alternative therapies, make dietary changes because this is a digestive disease, and also to change my doctor, especially when he suggested a feeding tube. So given this context, I think I believe that we don't often choose whether or not our families are involved in our care. They just are. From a South Asian perspective, they have a lot of perspectives on how we should be managing our care, how we should be managing the disease, and everyone has a say. But I believe that we can shape the ways in which our families engage with our care, and we can shape it in a way that's beneficial for us as patients as well. And this is something that we need to do and be open with our families, communicate our needs, but also push back and call out behavior that makes us feel minimized or less than. And this has been a journey that my mother and I have been on for many years as well. And I kind of, sorry for going off on a bit of a spiel, but I kind of wanted to turn it to Amma and ask her, how did you feel when I was diagnosed? And as a caregiver, do you want to share a little bit about your journey with IBD and all of the ways in which you've kind of figured out how to support me?
Madhura, when you're talking, I was recalling all those days when you were a real young child, right? So as you said, your symptoms started very early. In fact, 6 months, when you're 6 months old, I still remember. So when you started talking, I was taken back so many years back, or 28 years back when you were born, and the symptoms. So if you were to ask me, how did I feel when we got the diagnosis? It was a mixed feeling. A sense of dread, because that word kind of shook me, saying, what's going to happen to you in the future? You are all set to go for your PhD. So the first thing was a sense of dread. Oh my God, what's happening? And the second, weirdly, was a sense of, oh, I wasn't overreacting, because half the time, not half the time, most of the time, there was a lot of sense saying, oh, it's just a stomach ailment. You and Madhura are making a big issue out of it. Everybody has tummy upsets. Why are we making a big issue out of it? So there was this sense of, okay, we weren't really overreacting. There is some sense to what we were talking. That was a big thing for me. And the third was a lot of mom guilt. Even now, when you're talking, my mind immediately goes back. What happened during pregnancy, it was a cesarean delivery. I start beating myself up as to why I didn't do sufficiently. Did I somehow, when I read more about Crohn's, and there are correlations which say, cesarean delivery, not fed, all that are related, then I start beating myself up thinking, did I somehow cause it? And did I somehow delay it? Right? In your case, it took us almost 20 years before the diagnosis. We really got a label to what was happening. There were multiple labels given. When we finally were told it was Crohn's, a lot of mom guilt. Did I somehow caused it? And why didn't I take it earlier on? And beating myself for the delay. So it was mixed feelings, dread, guilt, and also feeling, oh, I wasn't overreacting. These are the three things on top of my mind. Yeah, that's the first sense.
And how do you deal with that? If you share?
Yeah. So I didn't have a choice, is how I will say. It's you just need to get up and start moving, because you were struggling, you were losing weight. There were so many things. My first reaction again was, I wasn't thinking so much about diagnosis as much as about the endoscopy process. You were preparing for it and the test had to be done. So I was like, having blinker saying, okay, what next? I need to get her out of the hospital. My questions were, what can I give her? What is the medication? What was the food? I literally switched quickly to take charge. So what medication, for how long, what food, when should we meet you next? So what next? So I didn't really have time for wallowing. It was like quickly jump and take charge. So I think that was it. So it was guilt followed by take charge. If I were to say, it's like, you have one wet blanket around you. There are times you hide in and cry, but you also have to wear the cape and fight. So you do this, most times fight, sometimes cry. So it's like managing both. Yeah.
Auntie, can I say, I didn't mean to interrupt, but I'm just listening to you speak, and I think listening to you talk about the feeling of guilt, I think, is something that a lot of parents, particularly mothers, experience, that I hear in clinic. And
Yeah.
it's unfortunate because really it turns out there's nothing that mothers or parents have done at all. That's
Yeah.
not how this illness works in any way. And you know, I just wanted to ask you, like, you know, you felt guilt, but then you said you have to keep moving, you have to move on, right? Move forward because you're taking care of your daughter and so many responsibilities. Did you feel that you had support system? Did someone else support you in the family structure with these feelings? Because it may be hard sometimes to talk about those things too.
I did have support, doctor, but yes and no. But you know, you quickly learn beating yourself is not going to help anybody. You quickly need to understand you didn't cause it, the patient didn't cause it. Somehow you have to come to, I mean, you just come to the sense that, you know, it's okay, I didn't really cause it, or nor did the patient will it on herself. You seek support, but I think it took me some time before I realized I need care. I was more in the caregiver than realizing that, you know what, I need some time to step in and take care.
I think that's important because, you know, we're here talking about how do loved ones like yourself be a caregiver for a patient. At the same time, there's a stress on a caregiver, and we have to recognize that caregivers also need their support too.
I'm so happy you're bringing that, doctor. Many times it's not being recognized, right? It takes an emotional or physical, sometimes financial toll. And we need to deal with it in a very graceful manner.
And I think that's why the title of our talk, Family Matters, IBD becomes a family matter, not just a patient matter, but also family matters. It's meaningful. Right. So it's a double meaning here that's very encompassing as to what we're talking about. Well, thank you very much for sharing. Thank you.
Absolutely. And I agree, Amma. Thanks for sharing. And, you know, one thing that felt very powerful for me, both when, you know, we've been through this journey together, or we're on this journey together, but also when you were speaking, is the idea that, you know, there is a guilt, right? Like as a patient, I feel the guilt as well of having got this disease somehow, but there is a need to move forward and find ways that are enabling for both the patient and the caregiver to move forward. And the fact is, this is also it's also a relationship that goes both ways, and it needs patients to take that active role in that relationship as well and work together with our caregivers to create that enabling kind of circumstance for all of us. And, you know, with that, I also want to shift to asking Sharan about her experiences and how did your family respond to your diagnosis, and what do you think is a good way to kind of approach this conversation around IBD with family members, given that there is also that patient communication component that matters?
Of course, thanks, Madhura. I think for me, because I was diagnosed as a pediatric patient, my family were always very present when symptoms started, you know, going to the GP for the first time and then right up to the diagnosis 6 months later from when my symptoms started. And I think it was quite a confusing diagnosis experience, because I was a pediatric patient and I was trying to absorb everything the consultant was telling me at the time and not really understanding a lot of what was being said. And then you had my parents, who English isn't their first language for both of them. So they were trying to do the same thing I was, but trying to absorb it from a point of view where, you know, Punjabi is their first language and they're hearing all these big words and things. And it's related to, you know, their daughter's diagnosis, but they're not fully kind of understanding. So I felt that I kind of took on the role as interpreter without even realizing, but I don't think I understood it enough to give them all the information. So I feel like a lot of it was lost in translation for all of us. And at that point, I mean, this was in 2002, so it's been a long time. There wasn't any kind of effort made to, you know, involve an interpreter or even ask my parents if that is something that they would need. So I think that impacted my journey in a way that I didn't really understand how severe the condition can become or how it's going to impact me kind of moving forward. And I think that was the same for my parents. And just as Viji said, Madhura's mum, I think for my parents, it was kind of relief from knowing that they finally have an answer to all the symptoms I've been experiencing, but then concern and confusion because they didn't know what was next. And my mum had a lot of that guilt as well, kind of thinking, have I been feeding her the wrong stuff? Or, you know, during when my mum was pregnant with me, she had a pretty traumatic experience. So that kind of led to her not looking after herself. She was guilty about that, thinking, is that what caused this? So I think a lot of the similar kind of reactions to how have we caused this or have we done this? And then, but from that point on, you do just think, okay, we need to think about what's next, how to move forward. So I think for me, it was just not really understanding it properly at the time, and no real effort was made to help me understand it or my parents understand it. But from that point on, with extended family, I've always found that I'm kind of stuck in between, like, wanting to tell them everything, because all the kind of behaviors that we pick up, you know, like not really eating when you go to family gatherings, not really kind of involving yourself, or you just don't attend altogether. Having to explain all those things, it's sometimes easier to just lay it all out and say, like, this is exactly what it means to have Crohn's and what I deal with. But what I have found, that when I start that conversation, you're often met with advice and people telling you, maybe you should do more of this, maybe you should do less of that, or eat this, don't eat that. So I've always found it very tricky sharing with family members and how much I feel like I can share, because I don't like, I feel like they kind of shift the blame back onto us and almost make it seem like, well, what can I be doing to change this, or what can I do better? So now I find that, you know, all the incredible resources we have out there, especially, you know, with SAIA, everything we're building together, I kind of direct them to information and say, like, have a read of this, you know, look through the information and it will explain things better. And then if you have questions for me, come to me and then we can go through it. But I think what's important to really discuss with family members is that, you know, this is a spectrum disease. You know, if you've heard that someone is doing well without medication, or, you know, they've been able to make dietary changes and that has worked for them, that's not going to be the case for the next person. So I think it's very important to highlight that this is an individual condition, and just to be there, you know, if we want someone to talk to and to support us, just having someone to listen to you really helps. So I'm quite selective with the family members I do choose to share with, because of the experiences that I've had with some not really understanding. But I think it's a matter of knowing who you feel like you can really open up to. And, you know, the ones that you feel that maybe can't or don't understand it, like I said, I tend to just send them as much information as I can so they can go away and read it themselves.
Absolutely. Thanks so much for sharing, Sharan. And, you know, shout out to all of the people who are listening and all of the people in the back. IBD is not caused by the patient. IBD is not caused by the caregiver. Nobody knows what's caused diabetes, so stop the blame game now. I think that's really our take-home message for everybody who's listening. And I love what you said. I think a lot of this is about who you share with, how much you share, and we have an incredible amount of resources on SAIA as well as on a lot of the organizations that we partner with. So please do send your loved ones these resources. If you are loved ones tuning in, please do access these resources to learn more about IBD. And I also think, from my perspective, ask how you can help, and that often gets you the answers that you need as well. And, you know, we've discussed family from a patient and a caregiver perspective. Dr. Neil, I want to ask you, what do you think are some good examples of family involvement in IBD care, and how can loved ones get involved in IBD patients' care in a manner that's effective and helpful for the patient?
Yeah. Well, I was listening intently with, you know, Sharan's story about what she experienced and then what she's done on her own to try to help her caregivers and family just support her better. And I think that's something we can all learn from, right? It was, Sharan, I think it was on you, right, to teach family how to do that. And that's unfortunate, but that's the common story in for many patients, where the burden is still on the patient to teach others while the patient's still learning, right, how to navigate this. So when I'm a physician seeing a patient for the first time or the umpteenth time in clinic, I often ask, especially when the going is tough, would you like me to talk to your family? You know, I always ask about the family structure, and I get concerned when I don't see a family unit there, when I don't see a spouse or someone coming. And I'll ask the patient, you know, why that is very head on to see if they have a support system. But I think that when you're first diagnosed as a patient, the words coming out of my mouth are like an avalanche of information and questions. So I think one of the things a family member can do is be present, meaning come to the visits, help make appointments, take notes during those visits, because that will help the patient, you know, feel that they're not missing out on anything, that they can actually piecemeal the information and go back and look at these notes and ask questions, even in real time in the clinic, and that they have a second set of ears. So I think one of the most important things is that patients, caregivers, and family or spouse, partner can come to clinic visits. They can learn more about inflammatory bowel disease on their own through all the great resources that SAIA has, that Madhura mentioned, and all our partner organizations. So they can read and arm themselves with knowledge, but then come to the clinic and take notes and ask questions and be that sounding board, so that the patient leaves with a very much more of a 360 picture of what's going on and the game plan. I think oftentimes when you're a patient and you're a family member, you may feel guilty also about asking how your loved one feels. And you don't want to ask too little, you don't want to ask too much. But sometimes the IBD can, for a patient, can get too normalized, and that's not a good thing. So I think I want to encourage patients and their family members and caregivers and support partners to ask more often, how are you feeling? How are you doing? How are you feeling about this disease? Even if you're well, like, how are you feeling in general? What's your outlook on life? How are you, these types of questions are meaningful, important to ask. So checking in with your family, with your patient, who's your loved one. Also, I think family members can play an integral role in finding support groups, because as much as we love our family member who has IBD, it's helpful to have that person meet other Crohn's patients or meet other colitis patients or other IBD patients. So there are many support groups throughout different regions of the globe, and it's not impossible to find a support group. And sometimes there's virtual support groups, right? That's exactly what IBD Daisies is. When you don't have a support group in-person meetup, you can look online for virtual support and community. Another thing I think that is important is that family members shouldn't get too upset with their loved one. If the loved one is ill and can't make family events or can't make a social event or has to change plans, like, be patient with them, right? They're not feeling well. They're not up to it. They're not blessed with the health that the family member may have. So don't try to get upset at your loved one. Don't make them feel guilty, because what they're going through is really an unfair time of their life, and that guilt and tension build when we don't talk or communicate. That's true of any relationship, be it parental or romantic or fraternal, sororal. So you have to talk about feelings and make sure that neither party feels guilty about not talking about the elephant in the room, if you will. Another thing that I've seen is diet. So many family members who are prepping food for the family's lunch or dinner may ask about dietary restrictions or sensitivities, but sometimes that gets to the wayside. So try to be sensitive a little bit more about meal planning, because meals are meant to be shared together, not watching Netflix all the time and having conversations. And so meals have to be intentionally planned, because we share food together, we break bread, if you will. And so you have to also be mindful of what's on that table. So a couple of the things that I think are important are really basic and key. Family members can read and arm themselves with knowledge. They can help make appointments for the patient, help them get that off their task list, go to the visit and take notes so that they're getting in-depth information and have a second sounding board. And they can also communicate better by checking in with their loved one. How are you doing? How are you feeling? How's your diet? Is there anything I can get you? Anything different we can do in our diet that'll help you feel better? And also not incurring guilt about missing social engagement. So those are my big swipes.
I love that. And, I think what you said echoes, right? There's so much that loved ones can do in a manner that is within their capacity to support a patient. I love the idea of going to visits with the patient. My mom comes with me for my visits, and so enormously helpful. the other thing that the two of us do is to actually workshop what I'm going to discuss with my doctor prior to the visit, so that I have a list of bullet points of concerns that I absolutely have to get addressed. And oftentimes, being me, I forget that, these are some things that I had in mind. These were some key concerns that I had. So for instance, I might have had some major symptoms and some minor symptoms. And in presenting the major symptoms, I might have forgotten to tell the doctor that there were, hey, there were these other things that were happening as well. And that's another place where a caregiver might be very helpful in a appointment, to be like, hey, Madhura, do you want to discuss some of these points as well? For me, that's been an enormously helpful situation as well, to have my mother in the room. And I love what you said about family gatherings as well, and finding new strategies to engage your loved ones. Sorry, Dr. Neil, I didn't mean to cut you off.
No, not at all. No, you made me think of something else, which is how you will plan for your visit. And I think that's a big one that I almost missed, which is, plan with your loved one. And also sometimes some of those major or minor questions are awkward questions.
Yeah.
And are hard to ask questions. So sometimes it helps, I'm a big fan of role play. Sometimes it helps to role play with your family member. And that's another purpose of the family member, to serve as a role play. I'm the doc. How would you ask me that question, right? Just to understand how to verbalize and ask the words. I think that's incredibly important, because you're always pressured under the gun, unfortunately, in many clinics, because the clinicians don't have as much time as we'd like, right? So learning how to role play and ask those questions, that's another great thing that you're doing. Pre-planning for your visit, and then role playing for the visit too, if it's a hard visit.
Absolutely. Cannot agree more. And I think there's so many, we've touched on so many important strategies here. And I really want to discuss the elephant in the room that I think we've all alluded to, but haven't named, which is stigma, right? IBD is unfortunately a deeply stigmatized disease in the South Asian community. It makes it very hard to talk about. It makes it very hard to articulate what patients are going through. And it makes it very hard for caregivers as well to share their loved ones' experiences or seek support the way that they need. And, I kind of wanted to punch the ball to Sharan, and because she had started us off on this conversation about her conversations with her family members and how she prioritizes who she shares what information with. Sharan, I wanted to ask you, how do you deal with some of the cultural considerations that come up, some of the cultural barriers, and how do you think we can more effectively shatter the stigma as patients, clinicians, and caregivers?
Sorry, thanks, Madhura. I think, like I said earlier, the reason I am selective is because I know my family and friends. I know who's going to react the way before I even had that conversation. So I think for me, it's important to normalize having ill health conditions. I think when I grew up, I would never hear anyone talking about being poorly or being sick. I'd never known anyone to have a chronic condition in my family or extended family, but that's not the case. It's just that people don't talk about it. No one ever talks about the fact that you could be ill or could be on medication. So I think for me, as I've gotten older with this condition, because I think for the first 15 years, I kept it to myself completely, and it's very isolating. And it really takes a toll on you mentally, because you're having to kind of hide things. And, I would end up doing things that look kind of suspicious, like, why are you doing this? Or why, if I was at work, why did you spend like 40 minutes, in the bathroom? Like, what's up with you? I feel like you're having to then make excuses for things that are completely out of your control. So when I started kind of this patient advocacy work and really felt like empowered to open up about my condition and my experience, that's when I realized how powerful it can be to actually have these conversations, especially in our culture, because not many people are opening up about having Crohn's or colitis, and that makes it seem like it's not a serious condition. A lot of people do assume that it's a lifestyle disease. You just need to make some changes and that's going to make things better. But that's not the case. Some people are going through really severe cases with Crohn's or colitis. So I open it up by, so when I was at my worst, I had a stricture and then I needed emergency surgery. And I had an ileostomy for almost 3 years. And to kind of help break the stigmas, I kind of go into it. I just go into the deep end and go through how severe it has been for me, and tell them that, you know, this is how serious it can get for people with IBD. And, you know, there's cases that are even worse than what it was for me. One example is my Nandi, for example. She's lovely. I adore her. And, you know, I think growing up, she used to kind of say, oh, you're so lazy, you know, get up out of bed. You should be, you know, active, up and about more. And I used to get really frustrated when I was young, because I was like, you don't get it. You don't get what I'm going through. But then after my ostomy surgery, she came to visit me in hospital, and she watched me do a bag change. And she was like, I'm so sorry for, you know, how I used to kind of address everything before. I didn't understand how serious it can get. So I think sometimes just allowing them to see how bad things can be really helps open up that conversation, and it will hopefully help break the stigmas that are in our society. Because I think as a society, we're just so reserved. We don't like talking about, you know, our personal health conditions. And I think a lot of that has to do with the gossip it can lead to, because then you start hearing from other people, did you hear about so-and-so's daughter? And I think that is why we kind of try to keep things, you know, close to our chest, and we don't like to reveal too much. But I think by having that conversation, not only will it help patients going through it, it's also going to help people who are dealing with these symptoms but refusing to see a clinician. Because, you know, like you said earlier, Madhura, we tend to normalize these symptoms. Oh, you know, I probably just had something bad to eat and I noticed some blood in my stools. That's not normal. You know, blood in your stools, diarrhea, none of these things are normal, and they shouldn't be happening. So hopefully that conversation helps people who are yet to be diagnosed as well.
Thank you so much, Sharan, and thanks for being so vulnerable and sharing your experience as well. It takes a lot of courage to be vulnerable in public. I know it as a patient, and I can hear how challenging it was. And you know, we've just had a question come in as well, asking how do you explain to family about the severity of the disease? Sometimes we also don't cut it, and it is these experiences that, you know, suddenly open the eyes of our loved ones to how challenging this disease has been, and the fact that it's invisible makes it that much harder. And sometimes it is worth persevering. But I just wanted to say thank you for being so vulnerable with your experience today. It really makes a difference to all of us.
Absolutely. I mean, I think that was really important to hear and to show a concrete example. Not that that's always necessary, but I think it's very illustrative that people have no idea, family members have no idea what you're going through. And it took seeing an ostomy change, right? For them to physically, organically, tangibly understand how impactful this is, right? And that seemed to transform the relationship. I'm glad that she was able to begin to empathize, you know, with your situation and express that too. But it was obviously not an easy experience. Mother, I'm curious, you know, you're there, right? You know, in our motherland and the South Asian continent, you know, how has it been for you as a South Asian IBD patient there, navigating these cultural barriers, navigating stigma, and in some ways, I think, you know, it may be even more severe or not. What's your experience been, and how have you overcome this?
So I would say, from my perspective, I think, you know, cultural stigma exists across board. It exists in our in South Asia. It exists in the diaspora, and it takes very particular forms in these different places, depending on our own historical experiences. But a lot of what Sharan is saying actually echoes with me as well, and that really goes to show why this is such a global problem and why we need to address it. For me as well, I think that idea of chi-chi, how can you discuss bathroom habits in public, stops so many of us from A, seeking care, like Sharan rightly said, and B, then when for those of us who live with this diagnosis, to talk about this more publicly and say, no, I live with an inflammatory bowel disease. It is very challenging. It does have to do with bathroom habits, but it's so much more than that as well. So in my case as well, I think having the PEG tube placed suddenly made it very alive to a large chunk of my family, that we weren't really, you know, it isn't just my mother and I in this kind of living in our own bubble of exaggerated symptoms, but this is actually a very real disease that has a very real consequence for me in terms of disability, but also in terms of the kinds of interventions that I need to live more fully. So for me, the feeding tube became an opportunity really to start sharing my journey more with my family members, sharing my journey more broadly with other people as well, because I was like, this tube is saving my life. I don't understand why you are so concerned about it. And here's how it's helping me. And that really helped me a lot to begin to destigmatize the disease for others, yes, but also for myself, to be like, what, I need to own the fact that I live with IBD. And the other thing that I would echo what Sharan said, and something that I do as well, is to think about my social circle not as a flat terrain, but to think about it as concentric circles. So the innermost circle is my mother as my caregiver, and my mother's smiling because she's so proud of all the academies she's taught me. But to treat the innermost circle is my mother, my mentor, my closest friends, and the outermost circle is a lot, like 80% of my family, extended family, and the proverbial log of the log kya kahenge, right? Like the log, or those nalapera, as we say in Tamil, who are society, so to speak, but they're the faceless, nameless people that we are so concerned about, whose opinions shape our views so much. What I found helps me is to treat my closest circle as a space where I can be my truest self, to be radically honest about what I'm going through, what is the kind of support I need, how I'm feeling about the way in which they're reading my disease. If I feel like there are times they haven't understood what I'm going through, I'm able to break it down better for them. For the more larger concentric, the outermost circle, I stick with saying, yeah, I have IBD. This is what it is. Sometimes I get snarky, especially when it involves certain desi uncles and aunties who want to tell you your mom has done something or you've done something. That's where my snark comes out. But I found that outermost circle usually consists of people who are there just to have an opinion, and they're going to have an opinion on you regardless of what you do. So I treat that as an opportunity to be public about my disease, to share education, to share resources. But their advice over time, I've learned, should be in one ear and out the other, because that's the only way I can keep myself well. And I will say to the questions that have also come in asking, what do you do when some people just don't want to hear? I think people who matter do the work. They want to be there how they can. People who don't matter may not do the work, maybe the people adding this pressure to you. And at some level, it's fine. It's okay to let those people go. They will come around at some point and they will learn. But it's important to remember that those who matter will do the work and will mind that they are taking care of you. And I'm curious to hear your thoughts about this from a caregiver's perspective as well, and how you shatter the stigma.
Yeah. Sharan, my heart goes out to you, right? And I'm going to put that on because not only were you the patient, but you were a caregiver for your caregivers. So translating, I mean, I really feel it. Madhura, I'm just talking some thoughts as it comes. I may not answer your question straight. These are thoughts when I heard Sharan and Dr. Neil talk. One was I think in South Asia, whether we are in India or elsewhere, we show love through food, right? All our rituals are about the dozen things we have to make and make you eat, right? Somewhere we have this feeding is the way of showing love. And if I don't fill your plate, I feel I'm not doing good enough. So that was a big learning. You don't have to eat what I cook or whatever to show that I love you, and you don't have to eat all the dozen things I make for a festival to make you part of it. I think that's very important. Food is not the only way to show love. Very important. And for us, it was very difficult because you've been brought up on this very South Indian idli, dosa, curd rice, and you couldn't eat any of them. So it was like, so talking to family members saying traditional food is actually not working for her, and we have to find ways that she can eat is very important. So as a caregiver, that's the big challenge in South Asian, for South Asian mothers, right? Food is not the only way to show love. All the Diwali sweets are not the only way to celebrate rituals. That was very important for me. And take up your case wherever we go, saying, there are other things Madhura can eat. There are other things we can do together to celebrate. And also things like the longs, IBD patients need your bathroom breaks. We need to be conscious of it. We can't make you sit for long ritual things. So to be mindful of all that when planning rituals was important. Food and that planning, and it's no big deal. We might do a puja, but you need a break. You need a break, right? And that was big thing. That having and bringing that into the conversation, it's just a normal bodily thing, and let's not make a big hoo-ha about it. Those two things were very, very big, dealing with the cultural issues of the family. Third was, I go back to what Dr. Neil and Sharan said. He said about asking, how are you feeling? I think somewhere we need to um, develop that third sense, right? Sometimes the patients get very impatient. If I go ask her, how are you feeling? She barks at me because there's so much they are dealing with and they don't want to answer. They say, just leave me alone. Somewhere we also need to sense how are they feeling, because as she said, there's a concentric space, right? In that space, they're going to be very vulnerable. They are going to take out their anger because that's the only space they can be their self. So also take, if something is happening, it's not the person is angry with you, it is just a venting, right? And not ask all the time, how are you feeling? How are you doing? But be sensible about it and give them space. If they don't want to talk, it's not that they're angry with you, just they need some time out, right? So to be sensitive when to keep quiet and when to ask becomes super crucial. Navigating that space is important. Same thing with doctor appointments. You need to go, but you also need to know when to shut up. Let the patient talk, right? You cannot be the mouthpiece or all the time. You might slightly intervene and say, would you want to talk? But if you take on the taking charge, it's a very difficult space to be in. So in that inner circle, you need to maintain that balance, knowing when to talk, when to shut up, knowing how much to talk to the doctor, giving them the space to deal with their own issues while you hold fort and let them be. So that's my bit. Food, rituals, bathroom space is normal.
I love
And
that. I love the idea of kind of
have the space. Yeah, keep the space for them to vent. It's okay. It doesn't mean that you are angry with me. It's just that you are dealing with so many things, and yeah,
no, I love
okay.
I love that. I love the idea of reframing. I think that's so central to a lot of the conversations we're having. Having IBD is not a death sentence. There are ways to reframe our rituals. There are ways to reframe expectations. Can IBD patients be good partners? Yes, we can. Can we be educated? Yes, we can. Can we participate in rituals? Yes, we can. Can we be good parents? Yes, we can. And it's all about, I think, reframing that expectation, like you rightly said, Amma, and kind of finding new ways to be. And I really appreciate you saying hold the space, but also from a very guilty patient perspective of having yelled at you before. I think it's also important for the patients to recognize sometimes that we react the way that we do. And it's important also to be cognizant of how our caregivers are feeling and making sure that they're okay in the process as well. That's something personally important to me. And Dr. Neil, I want to ask you now, we've discussed this from a patient and a caregiver perspective. And we know that cultural cognizance is something we need across board, whether it's in South Asia, because it is such a, there's such a diversity in terms of cultural practices, ritual practices, or whether it's in the diaspora, where the South Asian community operates within a larger context of other ethnicities. So what would be your perspective to other healthcare providers on how they can be more culturally cognizant of what their patients might be going through, and how they can kind of figure out what is a healthy way to involve the family in the care dynamic as well?
Absolutely. I think clinicians have an extremely important role to try to normalize the conversation, to normalize the diagnosis. I don't consider inflammatory bowel disease to be a rare disease illness because of the prevalence, and because rather than being clustered in families in decades past, now we just see one person in a family. It's as the more norm in my clinical practice. So I try to normalize it, and I do that by talking about it openly and about my other patients. So I talk openly about, I try to do patient-centered care and personalize it, the plan. But I do talk about my other patients so that the patient doesn't feel like they're the only one. It's very easy to feel like that. So I talk about how they fit in the contrast to my other patients. When I recognize that family members aren't coming, I'll ask. I say, "How's your partner? How's your family? Supporting you with this diagnosis?" Very blatantly, I'll ask that question. And a communication strategy that I have in many of my visits is to, especially when it's something sensitive, I try not to sit across from my patient. I try to sit next to them. And so we have stools on wheels, and I just roll around and kind of talk to them side by side, as opposed to being across. And that comes across as, non-confrontational body language about sensitive subjects. I'm with them, looking at the forward with the same view. And it's a subtlety that I feel, pays off in terms of engaging them and helping them open up about stigma. Other things I do, depending on what they're into, there's all sorts of athletes and celebrities that have inflammatory bowel disease, at least here in the States, that have come out openly. I truly, truly wish that we had maybe some South Asian celebrities. If anybody is tuning in or knowing and wants to share your story, I think that being a celebrity is a superpower. And so if you're a celebrity who is South Asian and has inflammatory bowel disease, we would love to hear your story and how you have overcome that stigma, so you can be a role model and inspiration to so many others. But I think it's about asking about the stigma, asking about how their support system, how it's interpreted and reacted in their immediate support circle of friends. And if they're not talking about it and keeping it to themselves, I think it's a red herring. And I won't push my patient. I'll introduce them to online support groups, virtual groups, and then I'll ask them later at another visit or a follow-up phone call, that we're talking about some lab results. I'll ask them, so how's it going? And kind of broach. Again, clinicians, it's not enough to prescribe a drug. It's not enough to follow an algorithm. If you're taking care of a patient, it's because you value relationships. And you have to capitalize and leverage that relationship, because hopefully that means that the patient trusts you and you can guide the patient to a better acceptance individually of their own disease and help their support structure accept it too. So there's no one size fits all, but I think clinicians need to talk about it, ask about it, engage them, and then how you communicate with that patient, how you sit next to them rather than across. I think that's important too.
I love that. And can I just say, as a patient, for me, that makes all the difference when the doctor is beside me rather than across me, or when the doctor is, distracted with a couple of other things. I understand that doctors are busy and clinics are very challenging. But to me, when a doctor puts down their phones or their computers and makes eye contact with me and sits beside me, it makes all the difference in the world to me as well. And it helps me pay attention to what they're saying a little bit better. I also think it helps create a comforting space for the patient and the caregiver. And, I also very quickly want to ask Sharan and Amma, if you have one suggestion that you would want healthcare providers to keep in mind when they deal with South Asian patients. Sharan, maybe do you want to go first?
Yeah, sure. I think just taking the time to actually, understand a little bit about our background. So like when I was diagnosed, for example, I think just if in conversation they had spoken to my parents and understood that English isn't their first language, I think it would have been very easy for them to have set up an interpreter, and then the understanding could have been at a different level to what it was at the time. And also when it came to being referred to a dietitian, there was never really efforts made to understand that I am from a South Asian background, and that the food I'm eating at home doesn't really reflect the food that I was being told to avoid and to try as safe foods. So just really, taking a couple of minutes to understand what it means to be from a South Asian background and how that's different for us. And in terms of family involvement, the one thing I would say is to really try to understand that, we do come from a culture where family involvement is big. And if that's what we want, then to allow it, even if we're adults. I've had, nurses tell me when I've been an inpatient that I'm too old, to need my mum with me. And I just think, it's more of a cultural thing. And if I feel like my mum, she needs to be there, and like Dr. Nandi mentioned earlier, it's kind of like just having a sounding board. We discuss things together, and I know that if I'm there with someone, if I miss things, my mum tends to pick up. And when I was a teenager especially, I was a bit reckless with my diet and like medication, taking it on time. My mum would always call me out in appointments. She was like, "You're not listening, you're not taking care of your health." So if my mum wasn't there, I would have been even worse than what I was. So knowing that my mum was always there to support me and, call me out when I wasn't doing what I was supposed to be doing, my consultant appreciated that, that my mum was so involved in my care. And that shouldn't stop just because, you turn 18. It doesn't matter if you need your mum there. If I'm 30 and I still want my mum there, I'm going to have my mum there. So I think just trying to understand how different it can be culturally, and if family involvement is important to the patient, then to actually appreciate that and allow for it to continue.
Absolutely. And Amma, any quick thoughts from your end? You're on mute. The classic Zoom problem.
Sorry, Madhura.
No.
I echo what Sharan said, right? And I'm in India, and I'm going to talk about our Indian experiences. So the doctors meet us for a short time, maybe half an hour, 45 minutes in an appointment. But then your family is the one who's going to support you through till the next one. So somebody needs to take care of the symptoms, food, pay for it, because our insurance doesn't cover it, right? To keep things on track, family must be involved, right? In some way or other. In many cases, we know, it seems very expensive. So families say, why do we do this and take an alternate therapy, alternate route, because this seems too expensive. There are too many side effects. So healthcare providers need to understand that they are meeting the patient for a short time, but the large chunk is spent in the family managing the dynamics, right? So it's not just the patient going through it, it's a collective support system of ensuring that you take the medication on time. It's not that we are taking, as Sharan says, you can be 80, you can be 30, but there's nothing harm on somebody keeping a track on, are you having your medicines? Are you following up? Is payments being done? Not from a pressure perspective, but a support perspective. And that needs to be understood. So we are not to take away the doctor's role, but we are there to support. That's very important. We are there as caregivers to support the person to become healthy and be the best possible, right? So we are part of the team. Some of us might be very intrusive, ask questions. Sometimes we might even question saying, is this the only option? Why can't I try alternate therapy? Because my uncle from US said that's the best thing. If I get an answer, then I'll feel good because I take it back to the larger circles. So, so please bear with us because we are part of the deal. So that's what I would say. And we are there. We are allies. We are part of the thing. The second part, Madhura, is, there are times when the patient is so unwell and we have to reel out many things. So you can't expect the patient to remember everything, particularly when they are in severe pain or distress. So having that case study, case history, and saying what medication you took becomes important in those really tight situations when we are rushing you to get treatment. So somewhere somebody else knowing your case really helps. Not all the time you'll be getting that same doctor, right? So I'm only saying it just helps to keep us involved.
No, I think those are really important points. And, the case history is something that we do as well, where we have a written document of my entire journey and all the medicines I'm on, so that my mother also knows what's going on and can share with doctors. But I actually like what you said about integrating caregivers as allies in the care process. And the one thing that I wanted to highlight and kind of go back to what Dr. Neil was saying as well is sometimes we are going up against the rest of our families. It can be the patient and the caregiver making a decision, for instance, in my case, to be on a biologic or to be on enteral nutrition. And we are often going up against other members of our family who think we're nuts, right? Like, why would you agree to a intervention when the uncle in the US said Ayurveda will cure it? And I think for healthcare providers, it's very important to be cognizant of the fact that this is an invisible psychosocial burden that patients are carrying as well. And like Dr. Neil said, please ask us what is going on, and please ask us how we are coping also with some of these cultural elements that go into decision making. So when we talk about shared decision making, it isn't just the patient, but it's also the primary caregiver, and it's also keeping that family context in mind. And that cultural cognizance makes all the difference for our care. So that's, just wanted to refer back to what Dr. Neil was saying as well about that kind of repeated questioning whenever you feel comfortable with the patient to ask, hey, how's it going? And how are you coping? And, we are kind of heading towards the last portion of our discussion now. And I wanted to raise some of the questions that have come in from our audience. And we thank everybody for listening so far, for staying patient with us, and for also sharing your questions in advance and putting them in the chat. One of the questions that has come in is, how do you provide support to a loved one with IBD when family is far away? Sharan, do you have any thoughts on this? And Dr. Neil, if you have any thoughts as well.
I think with the family being far away, so from experience, like I could go back to when I was at university, of course, it wasn't that far, but I was for the first time away from my family. And I think it was just regular check-ins. My mum would call me every day just to check in how I'm doing, how I'm feeling, how is my health, is there anything that I need or any kind of support that I need. So I think just regular check-ins really can help, and knowing that, even if your family's far away, they're still, thinking of you, looking out for you, and they're there in case you need. And for other areas, I would suggest joining, a support group. The support group we have, the IBD Disease community on Facebook, is incredibly valuable, even for me. And I find that, at all times of the day, you can drop a question there and someone is going to respond, someone is going to be there. So having that virtual support, I think, has been really important as well. There are various organizations who do virtual events regularly as well, or even in-person events. So if you feel that, your family's far away and maybe a local support group could help you, then, look into joining one of those as well, so that you don't feel like you're completely isolated.
I cannot agree. Dr. Neil, sorry.
Sorry, I'll add to that, Sharon. I think those were great suggestions. I was going to say, the nice thing about the modern era is if you're a patient and you're far away, your family member can also call in to a visit. And so, I always recommend, give the doctor, like when you're checking in and they're taking your vitals, just tell the medical assistant that, hey, please let the doctor know, my family would like to tune in. Is it okay? I'm going to have them on speaker just so they can participate and hear along. And that's usually okay. Just give them the heads up, and I think that's great, right? They can listen along at the very least. And sometimes, some practices will do televideo, and you can send them the televideo link and they can tune in that way through a video link. So I think those are concrete ways where the clinician can help you get comfort by having a family member along, either through the phone call or through a video call too.
I love all of those suggestions, and I think technology has really revolutionized the ways in which we can be there for our loved ones and ensure that nobody feels alone and isolated. I would also echo, please encourage your loved ones to join support groups like the IBD Disease support group, so that they can understand this disease better as well, and they can support you through the journey as well. One of the other questions that has come in is, how do you, as a parent whose child has IBD, especially if you've had, when I've had pediatric symptoms, for instance, how did you gain confidence to deal with IBD or with a diagnosis like IBD and pass that confidence onto your child? And how do you deal with the guilt, Amma, for you? And for Sharan, as a lead on from that question, how do you feel from a pediatric patient's perspective that you can talk to your child about IBD? So Amma, maybe would you like to go first?
Yeah. So I'm going to reflect on not the IBD diagnosis because it came late, but we knew many things about it, right? So as a parent, you try to make sense of the disease and communicate to the child in whatever easy to understand language. For example, I would say that you have some stomach illness. There are certain foods which are making you unwell, and you need to be, there is the illness that it's not, there is a illness. There are certain foods which are irritating you, and having a diaper is not such a bad idea. If you need bathroom breaks, you need to talk. And I remember going to the school and talking to your teachers saying, this kid has certain issues, and if she needs bathroom breaks, it's because of this. And so involve the teachers, talk to the student. I mean, the patient is easy to understand thing. You don't need we didn't know that you had Crohn's, but we knew there was a stomach illness. And not make it so scary, but ensure that you knew that you need to watch out, and when symptoms go, that you are going to come back to report. You will not, I mean, 8 times bathroom is something you must report, because that's the only way we will know that we have to take care. So talking to the patient even when they are young, but in easy methods, keeping the school involved, were the two things that we did.
Yeah. Sharan, would you like to add to that as well?
Yeah, sure. I think as a pediatric patient, so I think in my situation, I didn't really have any choice but to be heavily involved right from the beginning, because I was kind of the middleman in between my parents and the consultant, trying to understand it. And I think that allowed me to gain confidence, and just own the fact that I have this condition and I have to make the best of it. I also think in a way, because I didn't understand the severity of it, I never really felt like this was a setback. I thought, the medication they're giving me is going to help, and I'm just going to carry on about my day. So in some ways, I wish that things had been different, and I'd been told about the severity of this condition right from the beginning. But in other ways, because I didn't have that information, it allowed me to just continue going on, as a child into my teen years. The only thing I would say is to gain confidence is, as a pediatric patient, do involve them in the decision making, even if they are a young patient. Obviously, depending on their age, if they're able to have that conversation, have that conversation in a way that they're able to understand and take it in, so that it doesn't feel so scary for them. Going through the tests and the scans that we go through as a child, it is scary, but maybe just laying it out for them so that nothing comes as a surprise could help. And then in terms of like the day-to-day, allowing them to gain confidence, joining these support groups is a huge help. Seeing from other people, how they've gone on to be able to get through school, to get a degree if that's what they wanted to do. They're working. This isn't, like you said earlier, Madhura, a death sentence. It's not going to stop your life. You just need to find ways to adjust to allow for this condition to kind of work side by side with your life. So if you need to take breaks, if you need to do things a bit slower than the regular person, do it. If you need 6 years at university as opposed to like 3 years here for us in the UK, take those 6 years. Do whatever it takes to live your life at your pace, and don't compare yourself to anyone. And I think that has allowed me to gain confidence in managing my condition, and hopefully with young patients. I think having that competitive streak in our society makes it very difficult for us to feel confident in living with a chronic condition. So I think just don't compare yourself to anyone, don't be competitive, and just live at your own pace.
I think those are enormously helpful points. And I would also echo that, involving children in the decision and explaining what's going on really helps. It helps to not feel like there are all of these things happening and you don't know why it's happening. I think knowledge is very empowering, whether we're patients or whether we're pediatric patients or adult patients. So it really helps to have those conversations up front.
Absolutely. I actually got a question. Can I share that right now?
Yeah, please.
It says, "Hi, everyone. Thank you for this great program. The shifting of blame really resonates with me. If there's time for questions, any advice on how to get family to understand the severity of the disease?" This goes back to what we were talking about earlier when Sharan and our panel were talking. Any idea on how to get family to understand the severity of the disease? I've tried sharing materials with folks, but it doesn't seem to click for some. Any analogies I could share? I'll take a crack at this, or a suggestion here, before I turn it over to my team. But I would say to whoever asked that question, I think this is, it's a good question. Sometimes not everyone's going to get it. It may take seeing a stoma change. It may take seeing a surgical scar. I would recommend this. If your family's not understanding the severity, one thing that your clinician, speaking as a doctor, can do is talk to them. So with your permission. So you could ask your doc and say, ask your family, hey, would you be open to talking to my doctor? And then ask your doc. And most doctors will say, yes, absolutely. We'll call and talk to them or have them come to the visit. Other thing is pictures speak 1,000 words. And sometimes if you have pretty significant inflammation, the endoscopy or colonoscopy pictures can share, you can even ask your doc to say, hey, if you need a disability letter, a work letter, or excuse letter, usually we'll say something like, so-and-so has severe something, and we write it in a way that it's not meant for a boss at some, non-clinical job title. So we write it in layman terms. So you can even share that. But I think showing pictures of your findings, having them come to a clinic visit, or having your doc talk to that family member, I think all those things are concrete things where a physician can impress upon a family member that they look good on the outside, but on the inside, you have no idea how severe what they're going through really is. I think that's powerful. I don't know of any analogies. I can always think of great analogies, but I think those are more concrete. Anything that you guys could suggest?
I think those are really helpful. The one analogy that I've used, and I don't know how effective this is or how helpful it is to say, when we have open wounds, when we fall as children and we get hurt on our shins and we have all of these nasty looking open wounds. So I always say, imagine you have an open wound and imagine somebody's taken like a metal scrubber that we use to clean dishes with and rubs it on that open wound. Can you imagine that pain? That's what I'm going through internally every time food passes through. I have these open wounds inside my bowel. And then when food is passing through, it's rubbing against that wound. It's causing the wound to bleed. It's causing the wound to give me pain. That's what I'm going through. And that's why I'm struggling so much. That's why I'm not able to eat the foods you're offering. That's why I'm not able to go to school the way that I want to or do my job the way I want to. That analogy I found to be helpful to explain. Some of the complications are a little bit more challenging. I've often described like a stricture or a blockage in terms of plumbing terms. So like, for instance, imagine, you've got like this clogged pipe and you're constantly poking through more food through that pipe, hoping that something will release. The only thing that happens is that the piping breaks and you call the plumber. So that's how I've explained blockages as well. And I found that to be very helpful because we all do it, right? Like all Desi people try all of our little fiddles to avoid a doctor. But in essence, that's what it does. Like you're pushing and you're shoving, but there's a very tight block there and food is not passing through and the plumbing bursts. That's how I've tried to explain a couple of things. I don't know, Sharan, if you have any other weird suggestions or weird analogies that you've used.
Well, in terms of food, Madhura's mum said earlier, food is our love language in our culture. And whenever I go to family gatherings, if I'm not eating or if my plate's empty, they do always say oh, you never eat. And it always comes down to my body image because I am quite slim. And the only comparison I can give them, and it's as blunt as I can get, is you may as well take all this food and just put it in the bin because it's going to shoot straight through me. That's how aggressive sometimes it is with the diarrhea that I get. So I was it's a complete waste me eating it. I'm going to need to run to the toilet within 5 minutes of having had it. So I think when you explain it in such blunt terms, it does then resonate, and they're okay, we sometimes don't understand because I think we're so used to hiding how we react to this food or how we feel. I've been to family gatherings dosed up on codeine and I don't let them realize that I'm in pain or that I've taken heavy painkillers just to be there. But I think sometimes just laying it out is, in your worst possible situation, if you're vocal about it, then it does start to resonate with these family members who don't understand. And also what Dr. Nandi said, I think we underestimate how much our clinicians can help us. I was going through a difficult time when I was at university and they weren't understanding that I was poorly and they kept refusing to give me an extension on my final year research project. And my consultant, when I did tell him, because I didn't know who else to go to, he was, really frustrated that they weren't listening. So he wrote out a very detailed letter that I took to the university, and then they finally understood everything that I'd been through, because a doctor's note, it just says Crohn's disease on it, and didn't say anything else. So they were like, okay, well then, how does this impact you not being able to get the work done? So when I went to him and he wrote out a very detailed letter and in layman's terms so that they could understand everything that had been going on, that really helped them realize how much I had been struggling trying to keep up. So I think, yeah, really do make use of your IBD team if you can, to help, whether it's, a boss or lecturers, family, anyone, to help them understand this.
I cannot agree more with that. I think that's a phenomenal suggestion from Dr. Neil. And if you don't already have a letter, please get a letter from your consultant. It makes a difference.
Yes. Any other questions?
No, I think those were the end of all of the questions that have come in. And I think we've discussed a lot of the topics that have come up as well. And, I just want to kind of, being cognizant of the time and thanking everybody for staying on. I wanted to but first thank Sharan, Dr. Neil, and Amma for doing this talk with us. I think there's so much power in all of us coming together as patients, as clinicians, as caregivers, to really raise awareness about IBD, to destigmatize the disease, to explain the disease to people around us so they understand this better, to remember that we're not alone, but also to advocate for treatment options, ensuring that everybody, the patients and caregivers, are educated and are empowered to accept these treatment options and accept that IBD is a lifelong disease that needs management. I think that's really where the power of what we do lies. And I'm so grateful to the three of you for making the time to do this with us today, especially given that this is Crohn's and Colitis Awareness Week. And I also wanted to thank Pfizer and 67 Health for their support in bringing this event to life, as well as our amazing team of patient advocates who are on the back end, who've been supporting us, who've been pulling all the questions together. We really can't do any of this without you all. Thank you so much, everyone, for tuning in. Wishing you all a happy Crohn's and Colitis Awareness Week. And please stay tuned to SAIA. We have a lot of other upcoming events, upcoming activities, upcoming resources, and we look forward to seeing you all on our group and feeling empowered by this conversation. Thank you so much.
Thank you all. Have a great weekend.
Have a great weekend. Bye-bye.
Thank you.